Our next guest is gastroenterologist Dr. William King of Wilmington GI. Well, welcome to the show, Dr. King. It's a pleasure to have you here.
Thank you very much.
Well, I'd like to begin today about learning a little bit about you and your background and your education, and I know our viewers out there are interested in hearing that too. So, where did you go to school?
Okay. Well, I'm a native of New Bern, North Carolina, first of all.
Oh, you are a North Carolinian.
Yes,
How about that?
So, born and raised there. I went to Davidson College for undergrad, and then UNC Chapel Hill for medical school.
Oh, awesome school.
I'm a Tar Heel. Then I did my post-medical school training in Boston. I spent 3 years in internal medicine internship and residency, and then followed by gastroenterology fellowship for 2 years.
Wow.
And then I was on faculty at the Boston VA and Boston City Hospital for a year.
Wow.
Before I finally made it back to North Carolina.
That's an impressive resume there. Well, now I understand that you're with Wilmington GI,
Yes,
and
ma'am.
so tell me a little bit about your group and where you're located.
So we're in Wilmington, and we've been in existence since 2000, so 13 years.
Yeah.
Okay. There are 7 physicians, Doctors Meyer, Kittinger, Heenahan, Klein, Carney, Sauer, and me. And we have about 7 physician assistants who assist us
Wow.
with seeing patients as well. So it's a busy office.
Very busy office. I have to, that's so funny. You know, you ask people about their children and what are their names or their grandchildren, and I'm like, Brett, Shane. I'm going, you know, and you just whipped out those.
I've done that many times.
I bet you have. Now, we recently had Dr. Sauer on the show.
Right, I know that, yes.
Yeah, and so that was a great interview, and so we're really happy to have you here today to learn about you. Now, one of the things that Dr. Sauer shared with us on this show, that she's now offering colonoscopies and endoscopies at Novant Health Brunswick Medical Center. Are you also offering those procedures there?
Right. Dr. Sauer and I sort of started that program together. We've been talking about it with Novant or Brunswick for years, and it finally came to fruition.
Finally.
It's been a work in progress, but we're very excited to be here. And we're both coming once a month, so it means one of us is here every 2 weeks right now.
Awesome.
And we, of course, hope to increase that as the volume increases. And hopefully this is the start of a big relationship with Novant, and we hope to have an office here where we can see patients eventually. I mean, that's our ultimate goal.
That'd be great if you had a satellite office in this area.
We think there's a need for more gastroenterology service to patients here, and we hope to be a part of that.
Now, speaking of gastroenterology, some of our viewers may not know what a gastroenterologist is. So could you explain that briefly for our viewers?
It's a big word, yes.
It is a very big word.
No, gastroenterology, I tell people it's from the mouth to the other end. So there's a lot of
That's
organs
funny.
involved. But the esophagus, stomach, small intestine, large intestine, liver disease is also part of our specialty.
I didn't realize that for a long time.
As well as the pancreas and what we call the bile ducts and gallbladder or biliary tree. So there's a lot of disease processes, a lot of organs, which is what keeps my job interesting.
Do you have any specialties or interests that you have in particular? Are you more interested in one area than the other? Or?
I think my particular interests are a couple of things. One is what we call inflammatory bowel disease. You may have heard of Crohn's disease or also of colitis. So inflammatory conditions, mainly of your large intestine, sometimes your small intestine. So I have a lot of patients with those diseases. I've always had an interest in liver disease, way back from when I was in Boston, and we have a huge liver practice in our office, mainly hepatitis C or cirrhosis patients, but any type of liver disease. And then, of course, our office, including me, see a lot of patients just for colonoscopy, for colon cancer screening, and then the myriad of stomach disorders, ulcers, acid reflux, and so forth.
What are some of the common symptoms and disorders that you might see at Wilmington GI? I know you briefly
I think
went
I
over
just touched on that. I think a lot of our patients also have what might be called irritable bowel syndrome, if you've heard of that,
Right.
or sort of irritable stomach syndrome and that sort of thing. So it's that plus the things I just mentioned, I think are big.
For many, many reasons then.
Right. Right.
Do you need a referral to see your practice?
No, not at all. You can call yourself, whether it's for an office appointment or a colonoscopy or whatever. Just call our office. You do not need a referral. If you have a physician, we will do our best to obtain your records, so we know some things about you when you come, but just call the office.
So if it were time for my colonoscopy, say, I could just call the office and refer myself?
Absolutely. If you had a colonoscopy, previously, maybe up north or wherever, we would do our best to obtain that prior to maybe me performing a colonoscopy, but just call the office and we will make it happen. Yes, ma'am.
Great. Not that I'm excited, but...
That's right. No one is, but you need to.
Well, one of the common things we hear a lot about is heartburn or reflux. Is heartburn and reflux, are they one and the same?
Yes. So we all have acid reflux to some degree, but basically every one of us.
I do, yeah.
If you eat too much or too late or whatever.
Or the wrong thing.
Or the wrong thing, you're going to have some reflux. So everybody has acid reflux to some degree. And we see people who have the more severe types of reflux.
And what would the symptoms of heartburn be? What would be the most common symptom of a heartburn?
So the most common symptom of acid reflux is heartburn, which is
that burning sensation in your throat?
Around your heart or underneath your breastbone,
Oh.
right. So a lot of patients have other related symptoms. They may have nausea.
Oh.
They may have just more frank chest pain that makes them think they're having a heart attack and go to the emergency room for acid reflux. You can have more stomach pain or more indigestion rather than true heartburn. And some people don't have any symptoms at all, which is a little scary, but we only see them when they have complications of reflux, yet they've not really had significant heartburn or whatever through the years.
What would be some of the common methods or a good method of treating heartburn or acid reflux? What are some of the treatments for that?
So I think you have to look at what causes reflux, and let me talk about those for a second. But I think being overweight is a huge cause, and acid reflux is increasing in America because the average American is becoming more and more overweight compared to 30 or 40 years ago. So obesity is a big risk factor. Cigarette smoking, alcohol, taking too many anti-inflammatory pills or aspirin products. Some medications, particularly prescription medicines, may increase the likelihood or exacerbate reflux, would be another issue. You hear a lot about a hiatal hernia, which is where the stomach protrudes into the chest cavity, which increases the likelihood or increases the severity of reflux. Hiatal hernias are often related to obesity, so that it's almost one and the same there. But then there's some patients who don't have any of those risk factors who have acid reflux, and that's because the real issue is we all have a sphincter muscle, if you will, here that acts like a one-way valve, opening only when we swallow to let our food or liquid pass transiently, and then closes shut. And people with bad reflux, that sphincter or that valve opens when it's not supposed to open, allowing stomach contents, acid, and other injurious enzymes to regurgitate or reflux backwards. So to answer your question of the treatment, it's if you're overweight, it's losing weight. If you're smoking, quitting smoking. If you drink too much,
Don't drink.
Cut down on drinking. Minimize use of anti-inflammatory pills or aspirin products. And then initially, just for mild symptoms, it's all the over-the-counter medicines, of which there are numerous ones now. The best short-acting ones are just the liquid Maalox, Mylanta type medications, or Pepcid AC, Zantac, that type thing. Those things, those medicines tend to work very quickly. And you have things like over-the-counter Prilosec or the generic omeprazole that while it is stronger than things I just mentioned, it does take longer to build up in our body to become effective. So if you go out and eat too much one night and come home and want to take something, it's not a Prilosec, it's an antacid or a Pepcid AC actually is more effective initially.
I'm curious, with the over-the-counter, for instance, omeprazole, can you stay on that for long periods of time? Are there side effects? Or?
Yes and minimal.
Yes and
the answer to those questions.
Yes and no.
You can stay on it long term. There's a common misconception that you can't. The package labeling for the over-the-counter products is don't use more than 14 days without the advice of a physician. And the reason for that is make sure you're not covering up a more serious underlying problem. And I think that's probably good advice. If you need that long term, come see me or talk to your regular physician to make certain that that's the right treatment for you, that's the right medication. The only long-term risk that I think is legitimate is an increased risk of osteoporosis. That is slightly, it's very slight, and obviously that's a concern mainly for women, particularly skinny Caucasian women, less so for men or other races. There is a lot of other talk on the internet about other long-term risk or potential risk. Most of that is probably not accurate.
Really?
Yes.
Well, that's good to know. That's interesting information. Yeah. Now, you talked about that sphincter muscle. How would you determine if that sphincter muscle wasn't working? Would you do, I know you wouldn't do a colonoscopy, would you do an endoscopy or?
Right. So, well, I think we do upper endoscopies. That's where we look from the mouth down into the stomach and the beginning of the intestine. Same idea as a colonoscopy, just a different instrument, a different direction, but one is sedated for that, just like the colonoscopy. You
said that so daintily.
But that can be very helpful to assess whether you really have reflux or not, and the severity of reflux, and answer a question of what medicine or medicines you need or don't need, and has there been any harm from the reflux? Reflux can do a lot of dangerous things.
I was going to ask that. Persistent reflux.
Right.
What might occur from the persistent reflux? What are some of the things that could happen?
Well, obviously, persistent symptoms, which are frustrating, but from my standpoint, scar tissue that can narrow the esophagus or your swallowing tube, so you have swallowing difficulties. You can have ulcers that bleed. And the most serious thing is it increases the risk of cancer.
Really?
We have a condition called Barrett's esophagus, which is a pre-cancer condition in the esophagus that results from reflux that can lead to esophageal cancer. So that's one of the reasons to do an endoscopy, to see if you have one of those complications developing, and again, to plan your therapy moving forward to prevent those complications.
Getting back to screening colonoscopies, how often, when do you recommend to get your first one, and how thereafter, how frequently?
So for the average person, it would be age 50.
Age 50.
Sooner if you have a family history of colon cancer or colon polyps in a close relative, being a parent, brother, sister, or child. And thereafter, if you have no polyps and no family history, it's every 10 years. If you've had polyps yourself, then it may be 3 years, maybe 5 years, depending upon the results. And if you have a family history, it's generally every 5 years.
So if you have no family history, but if you have, for instance, irritable bowel or something like that, would you have them more frequently, the colonoscopies, or it would still?
Not specifically for irritable bowel syndrome. Okay. You may have a colonoscopy to diagnose that, or at least to exclude other processes like Crohn's disease or ulcerative colitis that I mentioned. So you may often have one at any age for that evaluation, but you wouldn't need one periodically for those diseases.
Well, I just hear a lot of people say, I have irritable bowel.
Right.
That seems to be very, very common.
But that's not something that dictates repeated colonoscopies. Crohn's disease and ulcerative colitis do, but not irritable bowel syndrome. Yeah.
Well, all really good information. Not great to hear, but
well, I always tell people I've had 2 colonoscopies myself, so I know what it's like.
I've had a
few
myself,
wouldn't wish it upon my.
And the prep is always the worst.
No, absolutely, but
the colonoscopy is a breeze.
It's better than it used to be. The sedation for the procedure is a whole lot better. So the procedure itself is not the issue.
Yeah. So if our viewers out there would like to make an appointment, how might they do that?
Well, to call our office,
call your office,
which is 362-1011.
Okay.
We have a website, WilmingtonGI.com. But to call our office, and my scheduling secretary can handle everything. We are currently scheduling Brunswick Hospital patients through our office still, although eventually we may have a scheduler more locally, but now it's all through the office.
I was going to ask you that. So if a viewer from Brunswick County is calling your office, they should identify themselves as Brunswick County patients requesting to have their procedure at Brunswick
Absolutely, yes, or else we will never know. So just please state that and let us know. And
if they don't ask, you won't know. Right?
We aim to please.
They can't read your mind.
Right, exactly.
Well, Dr. King, it's been such a pleasure having you here. I can't tell you how much we appreciate your information.
Well, thanks for inviting me. I've enjoyed it. This has been great. Thank you.
You're welcome.